Perfect.
Good evening. I am Dipankar Khasnabish. On behalf of Heartcrafted Foundation, I welcome you to yet another episode of COVID Cares. This is a series of webinars which we are doing to showcase ordinary people who have done extraordinary work during the COVID times. We all know that when COVID hit us, especially on 23rd of March, when the national lockdown was announced, people got very scared. I will rather say people got very panicked. Most of us, especially people like us, thought of where will our supplies be coming from, where will be going if there is an emergency, where the maid will be able to come, the driver will be able to come. But very soon, we understood that our problems are nothing compared to the challenges faced by many others. It is very much publicized that there are millions of migrant laborers who suddenly ran out of cash, essentials of their jobs, came onto the road and started walking thousands of kilometers to go home. We also came to know there are equal number, if not more, who got stuck at their home in similar circumstances, many times without health care, without a proper shelter, and without any sort of support. Government took quite a bit of time to scale up its operations, but during this time, it is the thousands and thousands of Indians who went out of their way to support these individuals. Today, we'll hear one such story. But before we go there, let me spend a minute to talk about Heartcrafted Foundation. It's a foundation which is focused on working with women from the underprivileged segments of the society. We essentially work to give them a sustainable livelihood through various focused interventions in terms of factor inputs so that their productivity and income improves over a period of time. At this point of time, it is primarily working in the northeastern part of the country, but over a period, we hope to expand nationally. Now, let us come back to our speaker today. Today, we are speaking to Subhadeep Mondal. Subhadeep is a very good friend of mine. I mean, he is my junior in college, but we know each other for quite a while. I am a great fan of his personally. Um, First thing first, he is a co-founder of India's largest COVID-19 telemedicine initiative, Project StepOne. He is one of the founding trustees. And he is also a co-founder of a very hot startup. And Subhadeep has to tell me whether we can call it startup because it is very established now, called PregBuddy, which essentially supports women in the prenatal and postnatal stage. Subhadeep is a BTech and MTech in biotechnology and biomedical engineering from IIT Kharagpur. He also worked before his PregBuddy organization as a founder or prominent members of multiple startups like Flickstreet, Ghana.com, and Stayzilla. Subhadeep is a very good footballer. I came to know, I didn't know this, that he has represented IIT Kharagpur in Inter-IIT, which is a very demanding position, by the way. He is a speaker in multiple national and international forums and had been very active, especially during IIT days, in not being just volunteers, but founders of many student bodies. Some of them have scaled up very well. Subhadeep is also a Forbes 30 under 30 Asia Fellow. Just to add to this, Subhadeep's co-founder, Sarika Sivarina, has recently been awarded as IIT Kharagpur Young Achiever. This obviously goes to Subhadeep's credit also. Now, Subhadeep, of course, is pretty well known in the startup community today, but I know him more as somebody who worked very closely in multiple initiatives from our foundation, IIT Foundation perspective. So Subhadeep, very happy to have you here today.
Thank you, Dipankar. Thanks for having me here, and thanks for very kind words about me. It's a fantastic initiative to start a webinar series like COVID Care, which is allowing people to share the stories where people will be able to impact people's life at different capacities across during these hard times. I think it's good to hear those stories, and good to so that we can inspire people to actually start and join these initiatives at whatever capacity they can. So yeah, thanks for having me today.
So Shubhadeep, you know, you of course, I will come to your PregBuddy part later, because I know that during this time, there are a lot of people who were in the family way. The family had tremendous concerns, right? We have seen many situations where they were worried about which hospital to go. Some of the hospital, doctors they were attached to, their corresponding hospitals were not available because of COVID or COVID scare. People going to those hospitals were asked to first find out whether they are COVID negative. And I'm sure that your PregBuddy has been a great help to many people. And we'd like to spend some time there later. But first, I want to talk a little bit uh, about that project StepOne. I have uh, come to know first about it from the Aragya Setu perspective, that the integration of Aragya Setu with how to consult doctors when you really need to, when you are found COVID positive. And then of course I came to know much more details about multiple uh, state governments you have been working with. I read those report which only for Delhi you have, I actually like to project them while you're speaking, a number of people who have been reached out. I think it was a fantastic initiative, because more than anything, when you look back today in COVID, I think the biggest thing which we suffered is panic, right? I mean, there are of course cases which are in close to 2 million. There are deaths, but the whole country was like shell shocked, and that is the time where talking to a doctor who is qualified and who can actually assure you with the right steps and the right guidance was really invaluable, right? I personally remember, my wife had some challenge and we tried to reach and we are not able to get through any numbers because numbers are so busy. So many people are trying to call in. So I will like to start, you are in the ecosystem, but how you really got hooked into this idea. You are obviously the pioneer. So how you really came with this idea, and then how you really proceeded to build this particular initiative. And you can start with probably telling a little more about the initiative itself, what it planned to do and what it achieved so far.
Absolutely. I think I'll start brief about how we started. So and then tell you about more about us and what we are doing. So we started. A bunch of founders came together in the mid of March to form a group called Startup versus COVID. This was very very small group of founders, um, which gradually within few days it went up pretty big. We had around 100 founders connected together, trying to see in whatever capacity we can actually help in this time of crisis. And during this formation of the group, different people sort of volunteer to take up different initiatives, right? And then this period of time, me and a couple of other uh, startup startup or a few other entrepreneurs in the ecosystem, we sort of came together and thought, hey, we've been a part of the healthcare ecosystem for a while, right? And we know when we understand the value of what telemedicine brings, by connecting patients and patients and providers together, right? But that is something which we knew from a background, but we wanted to understand what problems government facing at that point of time. And what you saw at that point of time, especially working with in our very early days, we started working pretty closely with the Karnataka government. We figured that there are state specific medical helpline numbers, which is the 104 for every state. At that point of time, the 104 was running at max capacity in terms of the call volumes, right? Because everyone was panicked, as you said. People are calling 104 to actually get some reassurance, get some queries resolved, get to figure out which hospitals are actually admitting and so on, right? While that period of time, we figured that it was actually manned by call center people, which is also running out of capacity, right, to hire. So at that point of time, really government is feeling helpless in order to scale the entire infrastructure, which can support this panic sort of citizens, to actually support them with proper guidance, information, and so on and so forth, right? So we thought, hey, we build a scalable infrastructure and a scalable sort of centralized team of doctors and providers who can support different state governments to sort of help the citizens at this point of time. So we did two things well. One is we built a scalable infra that can handle call capacity up to like 5 million calls an hour. So we build it along with like closely working with people like BSNL and TNL, and we are able to get the support from the central government and the BSNL and TNL teams. We're able to scale our infrastructure to handle that many number of calls. And what we did was we became the backbone for all the medical helpline numbers for the states we started with. So we started with Bangalore in early March, March 28th, and then we started with very small capacity. So we wanted to understand how we can handle the volume, so on and so forth. So we started with 10%, 20% capacity of 104, and gradually over a period of 2 weeks, we sort of controlled the entire 104 call capacity, right? And then we learned with Bangalore, we did scale up an entire infrastructure in Bangalore, and with a period of time, we launched to Bangalore, then to Mumbai, then Orissa, Punjab, and gradually we are right now across 14 states across India. So I think it's and this is the tech infrastructure part. And the second is the supply infrastructure, which is basically the network of doctors and providers who are helping us. So initially, we started reaching out to all the doctor network across the country, and we got tremendous support from each of the doctor networks. What we did, we started with a very small capacity of 500 doctors. Doctors from different volunteer groups who sort of volunteered for the time. At least like 30 minutes to an hour every day, sort of helping us to sort of respond back to the callers on a day-to-day basis, right? And over a period of time, this doctors network grew to over 7,000. I think right now it's close to like 9,000 doctors, nurses, and mental health experts who are actually volunteering their time every day for this initiative to help citizens across the country. Since March and till now, there are a lot of volunteer doctors who are the real heroes who are actually volunteering their time and effort for this initiative.
So you said you sort of scale to some 4 million per hour the call capacity.
Yes, we scale our infrastructures so that we can handle up to 4 million calls an hour. So we haven't hit the capacity yet. We
Mm-hmm.
are still way above the capacity limit. We can still kind of handle the entire India call capacity and still won't be able to hit that limit yet. So we were able to scale up the infrastructure because we realized at one point when COVID was increasing in the very early days, especially in few states like Maharashtra, we figured that if the similar rise would have happened across all states, we'd have needed at least 3 to 5 million call capacity. But thankfully, it didn't happen at that scale across all states at the time. It happened one after another, and so in terms of call capacity, we are ready to make sure that our infra never breaks down, right? So whenever a patient reaches out or a citizen reaches out to a 104 number, they're able to connect with a doctor within a span capacity of 15 to 20 minutes. So from a technology point of view, we work with several partners like Exotel, Kalera, Ozontel, who have been a core, cloud telephony partners. So there are different tech companies who sort of came together to support in some kind of capacity, either it's terms of human manpower, infrastructure, translation, and so on, right? So thankfully, there are a lot of tech infrastructure peers came together and say, we can actually help you scale this call capacity to almost 5 million per hour. But the most important part of this is it was actually done with the help of the central team, the central government team, and with the BSNL internal people were able to bend rules for us to make sure we can handle that call capacity, right? So yeah, I think that's how which we did very early days. So we're still ready for handling almost, we can still handle more than like 5 times the call capacity which we actually happening right now across India.
So I'll just try to share this screen, which sort of uh, Project StepOne snapshot, which is 9th August. We are today, of course, 25th August, and things have obviously scaled up. The 7,000 doctors have become 9,000 plus, language supported maybe. Now you have obviously handled some of the most difficult states like Delhi, Maharashtra, Karnataka, right? These are real hotspots. Now, when I will just move to this. This is obviously. So these calls, when they are coming, not all of them we were obviously taking it to the doctor, right? Many of them were probably getting responded by some bots or IVR or something like that, right? Because some of them will be routine inquiry also, right?
Correct. So I think let me
So
explain how this works.
how did you build the system? Very briefly, because you need some domain knowledge also to understand, right? And also the understanding of the anxiety of the individual, whom should go to the doctor before they create some chaos. So just give a little bit of that.
Absolutely. I think let me help you understand how things work. So the way it happened was when a citizen is to call 104 for any of the states we're partnered with, uh, what happens is they go through a series of uh, IVR questions, which we had localized in almost most of the Indian languages. So depending on the state you're connected with, you can choose your own native language to actually understand these questions and respond to them. And these questions are built based on and was constantly updated based on the ICMR guidelines, right? So, and to understand whether the patients have any symptoms of COVID or not, right? And once the patients or citizens sort of respond to the questions, what we do is we disconnect the call after that, and we sort of tell them, hey, depending on whether you had symptoms or not, the doctor will call you back, right? This is how we started initially. And what we used to do is we immediately sort of understand that data that is sort of entered by the citizen, and is to we used to actually categorize into citizen into different categories, and based on that we used to connect them immediately with doctors who are available on our platform, right? And what the way I mean we're connecting them is every doctor who are online available is to get a patient's ticket or a citizen's ticket on their phone, right? So they used to use an application called Fresh Test, which is again a very large tech company based in India, serving global customers, who has built a platform customized for us to help doctors able to triage patients, able to call back patients on the same platform, right? And doctors used to immediately call them back within a tat of like 15-20 minutes, and we connect doctor patients, and is to connect doctor patients based on the language they can speak. So a Punjabi citizen was able to connect with the Punjabi doctor itself, so that it becomes easier for the patient to explain what they're going through, what are challenges they have, and easy for a doctor also to sort of understand and give patients that reassurance, give patients the correct sort of recommendations based on the patient's requirement, right? So, and what is to happen is immediately doctors to call them back, the patient is to get some care depending on the patient's diagnosis. We used to categorize citizens into different categories, of which we used to have something like COVID high risk, COVID quarantine, non-COVID patients, and spam and junk calls, right? So what we used to do is of this different categories, especially the COVID high risk and COVID quarantine cases, and the non-COVID medical emergency cases, we used to sort of pass on this data to the respective state governments every hour, right? So we used to pass on this data every hour to respective state governments we're working with, so that they can follow it up and take the necessary steps for the patients to be picked up from respective houses, to do a quarantine test, and to take proper quarantine measures, or to do a COVID test, and so on, right? So initially we started with just COVID triaging, which was what you see in the slide. We started with IVRS helpline and COVID telescreening. That's what we started with very early days. And then gradually with time, we figured how mental health is becoming very, very required across various states, because people are really, really panicked. They didn't know what to do. They're feeling depressed on as the sort of lockdown progressed. So what we did, we started working with a few state governments. We started working with Odisha, Punjab, right? Working, building a same, using the same infrastructure, but building a mental health experts sort of team in the back end who can sort of support, we can support the citizens by helping them, guide them what to do, what not to do at this point of time, and how to sort of give them the reassurance and mental strength to sort of go past this period. And there are a lot of anecdotes in this period of time where we were able to help a citizen within, like, we're actually at a point of suicide within a few hours after launch of the mental health counseling line, right? So and we have been doing this on a day-to-day basis. There are almost, like, right now around, if I'm not wrong, around 2,000 mental health experts are working with us across India, supporting all the mental health calls across the country right now, right? Again, the volunteer network also grew with time. So initially, we were just a team of 30, 35. Within a period of few weeks, we scaled to 100. Now, there was one point of time, we have, right, I think right now around 150 active volunteers are working across various capacities from various startups and companies across India, who are spending their daily 3 to 4 hours a day working and helping this initiative across various capacities, at various capacities. And very recently, what we did also was we launched something called home isolation and quarantine monitoring, which means people who are already COVID positive, how can you help them? How can you help them manage their health, or understand and manage their health for the period of 2 weeks, 10 to 10 days to 2 weeks, so that we can monitor the patient's health and sort of understand whether the patient's health is improving or deteriorating. Based on that, sort of connect them with the right, take necessary actions based on that, right? Same thing happened with home quarantine as well. So what we used to do is we actually work with a very we work with a set of nurses and few companies who volunteer their people to create a different teams for different initiatives within this entire project StepOne, right? For example, home isolation and quarantine was handled by a team of experts who are nurses combined with few people from Genpact who were sort of helping us with it. Then there was another team of donor, sort of plasma donor management team, who was responsible for helping us inspire, sort of educate people about the myths and realities for plasma donation, why it is important, right? How can they do it? Why there are no risks to actually go right now and donate plasma and so on, right? So we had created another team from Genpact and other few other volunteers that have helped us in creating the plasma donation team as well. And with Delhi government, we actually, we're very happy to sort of say that last few months, uh, you know some of our team members actually worked very, very closely with them, along with Dr. Suchin Vijay, who were able to create this first plasma donation system in Delhi itself, which we're trying to replicate across other countries, other states as well. Yeah, I think this is how the journey has been. I think I had been actively sort of looking at a few segments of this initiative early days for the period of almost 3 to 4 months before I started moving out. But right now there are almost 150 active volunteers from different parts of India who are doing amazing work in doing sort of increasing the sort of supporting the state governments and supporting citizens at this period of time.
Fantastic. Just I kept this on this share. This 3 lakhs is 3 lakhs people who could have spread to others, right? When you say 3 lakhs.
Uh, Correct. So 3 lakhs is basically the number of people. Uh, so 3 lakhs is
Who
basically.
if they would have moved out, tried to go on their own and all that without following the procedure and all, could have potentially affected others, right? So
That's
probably
correct.
few million cases have been avoided. We don't know, but
That's
it could
correct.
have been.
That's correct.
So
You're right.
fantastic. So this plasma thing, I think, is now, if I saw something that even US is now trying to look at this model of plasma therapy, because Delhi was one of the first one to push. Okay, so this plasma donation portal and everything was also built by this team, right? Which
Correct, that's true. So the
right.
entire plasma donation system was actually built, it's led by a doctor called Dr. Suchin Vajar and
Hmm.
few company called Genpact who volunteered. The entire BPO team sort of working on this initiative for 2 hours, 2 to 3 hours every day, and a lot of volunteers from our own team actually were participating in it. So yes, it's a joint effort for um, almost like 200, 250 people who are working on this initiative for the last 2.5 months, which has made it successful, I think, in Delhi government right now.
So yeah, that's great. And I also saw some other figures, in the report, which I'm sure, if every other state, reproduce their numbers, that increase in plasma donation by 1,000% and reduction in, the availability of uh, ambulances, I think has been reduced by 15 minutes, because, otherwise everybody was trying to, rush out without talking, because everybody's first reaction, if they had they had an attack. The first thing is, let's go to the hospital, let's block the bed. And if you are more resourceful, the more the resource you try to take. And the big challenge of this whole thing was resource crunch. So we don't know how many people may have been saved out of this initiative, right? There's a huge number.
Correct. I think
Which
that is exactly what we wanted to prevent initially as well. The objective when we started was we figured that well, doctors are the major fighters for helping us fight the COVID pandemic, right? So, but there are a lot of people who are unknown about whether they're carriers of this, they are symptomatic patients. They were actually going inside the hospitals and were affecting the health workers, right, in early days. The objective for us to make sure that we're able to build a telemedicine helpline so that people are able to reach out to providers easily, get that reassurance about, or get a sort of a basic reassurance about what they're going through, is it fine or not fine, so that they don't run to hospital or rush to hospitals
absolutely
and either become a carrier or be affected in the process, of going.
yes, absolutely, yeah,
So
yeah,
this is
absolutely.
one of the objectives why we thought we wanted to start everything.
Yeah, either a carrier or you get affected, and in the process you choke the resources which may be required by somebody much more in demand, right? That was a resource crunch.
Absolutely.
So anything from the PregBuddy, did you see uh PregBuddy calls going up and all, which is of course your company. I don't know how much you could spend time during these months on your organization, PregBuddy as such. So there are some any change in, did you also incorporate on that side for the expecting mothers, some special thing? Would you like to touch upon?
Absolutely. I think, as you know, we were not only a platform for expecting mother to connect with each other, but we also help an expecting mother to connect with their own doctor and hospital throughout the journey of their pregnancy and fertility. Right. So especially at this point of time when an expecting mother was not able to sort of go and visit for OPD, they were able to connect with their own doctor. They were able to stay in touch with their own doctor and the hospital throughout the entire period of entire period of this pandemic, right? So it helped them an easy transition for them to make sure कि, hey, uh, for a hospital to make sure the patients are able to get care in this period of time without coming to a hospital by connecting with their own doctor, and at the same time the patients are reassured that they'll be taken care of whenever they come to the hospital, and they can the best part was basically to make sure that they can now reach out to their own doctors very easily, which they don't have to worry about going to a hospital. And yeah, I think our all sort of our engagement capacity almost went up by 4-5x in this period of time. The hospitals are using it more actively than ever because with the increasing pandemic, what happened was the technology adoption by providers and the hospitals sort of increased rapidly, right? So there's a rapid increase of use of technology, rapid increase of use of telemedicine that has happened in the last 4-5 months.
Yeah. So both on your personal and professional side, it's I will not say it's a sweet spot because COVID is not something which is a very happy thing. But it looks like you had been able to touch a lot of people, uh, you and your team, in a very positively, which is probably the most important thing of every human being, right? Supporting individuals when they are in need. So would you like to probably share a story or two? Obviously you met so many good people, so many well-wishers, so many good doctors, paramedical, corporate people, your own, you know, other co-founders, techies, but one or two instances where you really touched you in terms of support or resilience or dignity, or, or you found government very easy to work with. You mentioned, like, building rules of MT and VSN, because normally we have, pretty negative impression about authorities, right? But this is a welcome change. Police, for example, many people talk to police. So anything like that you want to share?
Yeah, absolutely. I think the beauty of this initiative was this was a great public-private joint initiative that you can say that happened in the last 4 5 months, where people understand the need there are, and we being from the private organization, the only power we had was we are great with technology and people, right? So we wanted to sort of we joined together to sort of build the layout of the platform and sort of reached out to the government, gave to them, and sort of the best part was we're doing it selflessly at zero cost for them. So there's no process for them to go through, and they understood the passion that we had for solving them and supporting them, right? So and we gradually built trust with them, working with every state government, which helped us actually to scale and gradually grow to other state governments as well, right? So said that, I think the day when we went live with Bangalore government back in March and gradually full capacity in early April was one of the key moments for us, because that gave us enough confidence for the entire volunteer team to make sure that, hey, we are able to see them back, because every day at that point of time we were getting around we were triaging around 15 to 20,000, we were to 30,000 calls a day, in Bangalore itself, right? When you're handling the entire 104 capacity, right? So it was one of the key moment that motivated a lot of people to actually work, and seeing that they are able to impact, identify, at in those days were able to identify 5 to 10 COVID patients every day, which actually went up to almost 100. Now we do more than that, so on, right? So we saw that how we are able to identify COVID patients over telemedicine itself, able to help government connect with them so that they can actually take care of them efficiently, better, so that they can help and stop the spread of the virus. I think each and every point of time, I think it was a but the government was very helpful for us. They were very supportive in an initiative, whatever initiative they took. It was definitely a tough battle, but I think there was lot of very respectful IS officers whom I've worked with. We who actually understood the vision, understood what we were trying to help, and they sort of lend out the supporting arm and supporting hand, sort of help us scale the platform which we are today. So I think. We wouldn't have done what you've done today unless the respective state governments and the ICE officers were able to sort of lend out the supporting hand. So yeah, I think completely credit goes to them. Credit goes to all the volunteer doctors and nurses and mental health counselors who are sort of working on its initiative. And I think the backbone for this is the 150 volunteers, active volunteers who have been working day in and day out across the different companies and different states, selflessly for the last 4 to 5 months. So I think kudos to all of them. Being early members makes me feel proud about something which you started, but I think the credit goes to all the people who are actively working day to day today.
Yeah, I very well said. And what better thing to do in life than to save another life, right? I mean, that's the highest. So we don't know how many untold number of people, we know the numbers of people reached out and all that, but how many they could have probably um, affected others, how many could have been led to reach the hospital. You mentioned about people who were suicidal and they have been prevented on the way by somebody. So extraordinary work, and obviously, no words is enough. But congratulations to you again, to take time out and start it, because starting is the first step is obviously the toughest. And then of course when the initiative is good, a lot of good people come together, which has happened here. You got the support from all sorts of people. The initiative was good, the purpose was good, the leadership was good. And let's hope that it continue to support people, because COVID is not going to go away very soon. We are yet to
Sure.
reach our peak. Thanks for coming in. Thanks for giving your time. It's a pleasure, Shubhadeep, and see you soon.
Thank you so much. I would like one more thing to this. If so, we have Step One has launched a pan India telemedicine number. So initially we were working with the state government, so we didn't have any public number where people can call to. So now there's a pan India telemedicine number called 97456 where you, your family members, or your friends can actually call up and directly sort of get a call back from one of our doctors within very within 15-20 minutes. So please feel free to sort of share this number with your friends and family, so that we can actually help people identify the COVID symptom early and able to sort of spread and fight this virus. Again, thank you so much, Dipankar, for inviting me. Please take care, all of you, and have a good day.
Thanks so much. Thanks again, and stay safe. Let's connect as soon as we get an opportunity. Thank you. Good night.
Good night.